Thank you for your question on under eye bags and how to treat them. I've got here is a diagram of your and all of our under eyes. What you see here, just to orient you, there's the eyeball, here's the cheekbone, and then we have our lower eyelid and our lower eyelashes. There is fat that protects our eye and cushions it in the event of trauma, which is really awesome and protective. And then there is this ligament here. We call this the septum. And basically this septum, when it's vertical, keeps the fat in place. And these patients who have a vertical oriented septum have no fat bags, okay? So when we look at a patient who has some bags under the eyes, this is more of what we see. So instead of that vertically oriented septum like that, it's stretched. And this is genetic. You can't diet your way out of this. You can't take allergy medicine. You can take allergy medicine, but it's not going to change this. You can't diet. I already said that. So that's the deal. And so this extra fat, we call this pseudo herniation. And we call it that because it's not a true hernia where the fat is kind of poked through this septum, but the septum is just kind of fallen forward and the fat falls with it. So the only cure for this is to go in and remove this fat. And so we can do that through the skin approach, which is called subciliary. We can do it from the internal eye approach called transconjunctival. This is the way I typically do it, which leaves no scars on the face. The other thing that was asked about is filler in this location. What are we doing with that? Well, let's see. You can see kind of there's a dark hollow here. That's called the tear trough area, and that's caused by that shadow from kind of this mound or mountain of fat that's related to the eye. And then we have this valley right here, which is actually where the skin kind of indents and imprints on the eye bone, on the floor of the eye bone there. And then you've got your cheek here. So what we do with filler is a camouflage, not a cure, but a camouflage. And that helps blend the transition between the eye here and the cheek here. Hope that answers your question.